All right, everyone say hi to Josiah. He says hi. All right, so this is an infant who is conscious and choking, and then they go unconscious. So, baby, are you choking? Are you choking? All right, we can tell because he has obvious distress on his face, lips turning blue, gray color skin. Right, they can't breathe, they can't cry, they can't cough. Grab around the jaw, angle them down, tuck them in. 1, 2, 3, 4, 5. Hold on to the head, bring them around, tuck them in. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. You see that they're angled down, right? 2, 3, 4, 5. 1, 2, 3, 4, 5. Continue this until they get better or they get worse. 1, 2, 3, 4, 5. 2, 3, 4, 5. So they get better, they cough the food out and you can pick some out, or they get worse, they go unconscious. So if they go unconscious, we always call 911. Help, call 911 and grab a defibrillator. Tell them that there's an infant who's choking and is now unconscious. We're going to start CPR. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Look in the mouth, see if there's any food. If you see it, pick it out. If you don't see it, don't put your fingers in the mouth. And let's try a breath. That puff doesn't go in. So in this case, we're going to tilt more neutral because maybe we kinked the airway in the first place. So let's try another one. And it doesn't go in either. So 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Let's look in the mouth, see if we see anything. If you see it, pick it out. Try a puff. Doesn't go in. Try more neutral. And try another puff. Doesn't go in. So go back to compressions. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 30. Look in the mouth. Oh, there's something. Pick it out. Try a puff. And the puff goes in. That's good. Try another puff. And the puff goes in as well. So the airway's clear. Let's check breathing and circulation. 1, 1,000, 2, 1,000, 3, 1,000, 4, 1,000, 5, 1,000, 6, 1,000, 7, 1,000, 8, 1,000, 9, 1,000, 10, 1,000. All right, so the baby is breathing. So that's good. So going to roll the baby into the recovery position. Just like that. From here, we can go on to monitor everything from this position. So in our secondary survey, we would go into measuring the vital signs. So we can measure their pulse, rate, rhythm, and volume, their breathing, rate, rhythm, and volume, their skin color, condition, temperature, their pupils to see if they're equal and responsive to light, and their level of consciousness. We can do all that from this recovery position. All right, but we can't do it from this recovery position. Right, holding the baby like that. So we want to pick a recovery position either on the table like that or in our arms. And that's how we do the conscious to unconscious choking for an infant.